Adolescent idiopathic scoliosis has been one of my primary focuses for over 40 years. And it's important that you have a team that is capable of looking at the curvature of the spine and making the correct diagnosis.
In the age group of adolescents, so preteens and teenagers, they develop for some reason that we don't completely understand a C or an S-shaped curve to their spine when looking at it from the front. And we know from historical data that if those curves reach a certain severity and they're allowed to go untreated into adulthood, that they can advance and continue to get worse and worse and become very much function limiting into adulthood.
There's other types of scoliosis. Kids born with missing bones or additional bones can give you curvature of the spine. Folks that are born with certain neurologic dysfunctions can have scoliosis. That's not what AIS is. Adolescent idiopathic scoliosis is a particular type of curvature of the spine that we see in the early teens.
Treatment options for idiopathic scoliosis are watchful waiting, which is primarily reserved for very small curves or small curves in patients who are almost done growing. There's also bracing. Some of the best data that we have in pediatric scoliosis surgery is on the utility of bracing. It's very effective. And it definitely can halt the progression of a curve, especially during the critical growth years when adolescents are getting taller. That tends to be when curves progress the most. And so bracing is a very important strategy and tool that we have for treating adolescent scoliosis. And finally, there's surgery, and surgery is also a very good tool that we have that's really reserved for the patients with the most severe curves, the curves that have sort of crossed this threshold beyond which we know that if we leave them untreated, they're very, very likely to become a problem in future years into adulthood.
So it's the meeting with the family, meeting with the patient, establishing the diagnosis, and figuring out whether or not this is a progressive curve or not. Fortunately, even though the name of our group, Carolina Neurosurgery, says the surgery word in there, most of the time these youngsters are not facing surgery.
We are committed to establishing these long-term relationships with patients from the time they're young children well into adulthood, so that patients and families don't need to worry about sort of reinventing the wheel every time they want to go see a spine surgeon. They have one home where they receive their non-surgical and surgical spine care, and we can provide that long-term home for patients.
Carolina Neurosurgery and Spine offers physical therapy, physiatry, neurosurgery, orthopedic surgery, imaging, putting all that together under one roof. You take experience gained over time, added with new ideas that are brought in by bringing in extremely well-trained newer people. You have the best of both worlds.